Whereas on March 13th, President Trump issued a proclamation declaring the COVID-19 outbreak in the United States to be a national emergency. And whereas today, on March 17th, Governor Reynolds issued a state public health disaster emergency. And whereas the Iowa Department of Public Health and Governor Reynolds have recommended immediate implementation of several mitigating measures, including avoiding gathering in events of more than 10 people. And whereas the Code of Iowa and the Mason City Code grants the mayor the power in emergency circumstances when a public danger exists to take extraordinary steps to protect the public health and safety of our community. Now, therefore, I, Bill Schickel, Mayor of Mason City, do hereby proclaim the following. I've determined that a state of emergency or a public danger exists and direct that all gatherings of 10 people or more on public property or in a public right-of-way are hereby prohibited as of midnight tonight, and any permits or permissions previously granted are hereby rescinded. This proclamation of emergency and public danger is part of our ongoing response, the City of Mason City, to protect the public health and the safety, and may be modified or superseded with more restrictive prohibitions at any time as the circumstances warrant. And I further ask of all of our citizens to follow the guidelines set out by the Center for Disease Control, the Iowa Department of Public Health, and the Sarasota County Public Health Department. Now, why are we doing this? You've probably seen that this virus in other communities and other countries, when it comes in, it starts out very gradually, and then there's a quick spike upward. Our efforts here, really during the last month, Mercy Hospital and Sarasota County Public Health, are to reduce that spike. Is to through social distancing and some other measures, and Brian will be talking about that in just a minute here. Some other things we've learned, both through current circumstances and the history of pandemics, is that things can change very rapidly, and that's why communications is so important. We know that good information can save lives and bad information can be deadly, and so that's why it's so important that we stay in touch. It's also true that individual decisions matter. What all of us do can make a huge difference in keeping our community, indeed keeping our state healthy. And I very much appreciate all of the partners that have worked so hard to get the message out, particularly about social distancing, because that can have a huge beneficial health impact on our community. Just a couple of other notes. In consultation with the city administrator, he's made a decision to close City Hall to the public after close of business today. Now, the majority of our regular services will be operating, and the staff will be there to answer the telephone, answer your questions. Sanitation will continue to operate. Our public transit will continue to operate. All of our safety services, our emergency services will continue to operate. You can pay your utility bill, your water bill, you can pay that online, or you can drop by the drop box that's located in front of City Hall to do that. And the regular phone number at City Hall will be answering. Regarding tonight's City Council meeting, both at this news conference and during the City Council meeting, we're practicing a social distance. We have 3 council members that will be checking in remotely. The other 3 council members will be here so that we can demonstrate the necessary social distance to keep everyone healthy. We also encourage you to watch on television or watch online. Obviously, you're always welcome to attend, but during these unusual circumstances, we suggest that maybe you do consider watching on television or watching online during the City Council meeting this evening. Aaron, our city administrator, has been meeting with our department heads and our staff electronically and remotely in order to establish the social distancing practices that we'll need to continue to do during the next weeks and months ahead. Aaron will talk a little bit more about this in a minute, too. We've been cross-training our staff so that should our staff members become ill, we have the necessary backup in order to provide the community services that all of you need. I mentioned that our transit department will continue to run. It's a critical service for so many people here in Mason City, especially getting to work and for other things. The transit system is being disinfected on a regular basis, and we encourage you, when you use the public transit, to keep in mind that social distancing as well. I know our health department and Mercy Hospital are working on additional testing. Brian and Dr. Teresa will have some additional remarks on that in just a minute. And our health department and our partners have set up that phone number if you have questions, 494-3547. A special thanks to all of our partners that have been working on this, and a special thanks to our workers, particularly our healthcare workers, and I think of our sanitation workers, our emergency workers. These are workers that can't stay home. We're encouraging you to stay home if you possibly can, but we understand that some workers cannot, and we owe a special debt of gratitude to our sanitation workers and all those that are sacrificing so much for all of us. One of my favorite signs down in Central Park, it's on a bench down there when you take a walk along the Willow Creek there. We can't control the direction of the wind, but we can adjust our sails. So, for the last several weeks now, we've been adjusting our sails here in this community. And with that, I'm going to